Thanks Corey, and thanks everyone for having myself here today. I'm Liz Murray and I am here representing the Lyme Resource Centre, a charity focused on Lyme disease based in Scotland, along with a couple of colleagues, Arlene and Trevor, who are up there. I'll get them to put their hands up. Come and meet them on the stand. So what I wanted to talk to you about today was just to give you a bit of an update on where things are at with Lyme disease. But first, just a little bit about the charity. So I mentioned a charity focused on Lyme disease, registered in Scotland, but we do spread our wings and work a little bit beyond Scotland where there is interest. Our mission is really to prevent people suffering from Lyme disease, and we do that by trying to help prevent people getting Lyme disease, or if Lyme disease is suspected, that people know what is the correct and timely action to take. So a lot of our work involves educating the public and healthcare professionals about ticks, about tick-borne diseases and about Lyme disease. And what I was hoping to do today was to give you an update on where things are at in this world, so that when you're running your courses, you can be as well informed as possible about what the current status is and where things are heading. So I hope that's okay. I'm going to start with some very, very simple basics, which is to make sure that people know what Lyme disease is. I think people know the term, but actually, to tell you a little bit more about it, it's a bacterial infection that is caught by a bite from an infected tick. It gets its name from where it was first recognised in the States, a place in Connecticut called Old Lyme. But actually, despite the fact it's been known about for over 40 years, awareness of it between the public and of healthcare professionals is really very low. And that's where, the problems exist, and why a lot of the work that we try to do as a charity is important. A little bit about ticks, just to make sure you know about them. I'm sure you've seen plenty of them in your time, but they're actually part of the kind of spider family, in effect. 8-legged arachnids, and they basically crawl. They don't jump or fly, they crawl, and they crawl onto people, basically they like to live in places that are moist, shady, damp, and the important thing is that they like to feed on mammals: mice, squirrels, deer, horses, dogs, birds, and unfortunately for us, also human beings. In terms of where the world is going with ticks, one of the challenges that we've got in this area is that there's not a lot of really good data for us to draw on. I'll mention that a few times as I go through this presentation, but I'll try to, as much as possible, back up what we're saying with some data. What I think is clear from the data that there is that we're seeing both an upsurge in the ticks that already exist in the UK, as well as the arrival and the survival of new species of ticks. And of course, if you've got more ticks and ticks with carrying different types of Borrelia burgdorferi, because there's lots of different species, then unfortunately that also means the risk of tick-borne infections increases also. So, it's definitely something that we are seeing and hearing more about. Other things that are impacting on the evolution of ticks are probably things that you can think of quite easily. Climate change, for example, is something that is having an impact. Once upon a time, there was a clear tick season between spring and autumn. Now, we see that ticks are still around beyond that season, and even in some locations are around all year. The pandemic, for example, sort of drove people outdoors to, do their exercise, and actually a lot of people have sustained that. So people are, more involved in outdoor spaces than they might have been maybe 5 or 10 years ago. And then things like, migratory birds coming in from other parts of the world bring with them different tick species. Again, 5 or 10 years ago, they might have died or not survived because of the climate change. They are actually hanging around. And things like, really positive initiatives to do things like, preserve wildlife are great, but then it also brings mammals, you know, feeding vehicles for the ticks to areas that, you know, human beings might frequently inhabit. So that's another few things that are driving what's happening with ticks. Where can you get them? Well, the bad news is everywhere. So this was a survey that was done a number of years ago, actually by vets, where dogs that presented at vet practices that had ticks attached were logged. And basically they found that they used that to map where ticks were across the UK. And actually you can see there's ticks everywhere. The darker sort of purple, reddish colour, the higher the proportion of ticks. And you can see from that, you know, the Scottish Highlands, the southwest of England, East Anglia, particularly bad. But I think what's really important to note is that even in the areas on there that are yellow or blue, there are hotspots, whether that's a golf course, an urban park. So although, you know, there are definite hotspots, they can be found everywhere. Who is it that gets infected? Well, in a way, this is quite easy. Everybody. So this is some data from laboratory-confirmed cases of Lyme disease in England and Wales. And basically, the incidence of ticks, of infection, reflects the general population. The only slight variation on that is a slightly higher incidence of them in the 5 to 64 year age group, which actually includes me. So maybe it's just as you get older, you want to get outside a bit more, I don't know. So basically, anybody can get infected. Where do ticks bite humans? This might be something that it's useful for you guys to know. So basically, because they crawl onto people, or they crawl onto their hosts, what you find is that in adults, you're mainly bitten in the legs. So you can imagine people out walking with shorts on, for example, followed by the arms, again, wearing short-sleeved t-shirts. Slightly different in children. They tend to get bitten more in the head and neck. And certainly, you know, their bites tend to be above the waist. So if you want to look and check for where ticks are biting people, this is a good indication for you. A little bit more about tick bites. First of all, you know, they're painless. So if you don't see it, you're probably unlikely to know that you've got one. When the ticks attach, you know, they feed on the blood and become engorged. They can vary in size from absolutely tiny little things the size of a poppy seed. If you've been to our stand, we've actually got some examples of ticks of different sizes that you can look at, and the smallest ones are really difficult to see. Not every tick carries the Borrelia infection, but the problem is you don't know just by looking at a tick whether or not it has got the infection or not. So it's important that you take any tick bite seriously. Sometimes you hear people say that, you know, there is a certain time period by which having an attached tick may or may not cause problems. The reality is that we don't know how long, you know, a tick has to be attached for to cause problems. I think and also ticks carry lots of other bugs, a few examples shown on the slide there, which can also transmit in different time frames. So really the kind of message here is that, you know, the sooner you get the tick off, the better, but you also have to get it off safely. If it's left attached, it can feed for days, and they can become quite engorged and quite big. So that's a little bit more about the tick bite itself. I think, you know, I've talked a little bit there about the fact that we are seeing more ticks and the risk of tick-borne infections is increasing. But we have got a little bit of evidence that that is happening. So again, some old data because of the situation we face, but if we look at laboratory-confirmed cases of Lyme disease between 2013 and 2017, again, this is England and Wales, but there was a 35% increase in between those two time periods. Now, that's laboratory-confirmed cases, i.e. in the NHS, somebody's had a test and is tested positive. But actually, as I'll come to tell you a little bit about it, that testing is not very reliable. And in actual fact, there was some work published data more recently in 2019 that suggested that the incidence of Lyme disease was at least 3 times what was shown in that testing data. So, I think we can definitely see that this is becoming more of a problem. What's also a bit of a problem is diagnosing Lyme disease. The key message here is early and adequate diagnosis and treatment is the best sort of chance of getting full recovery. Why is diagnosing it a problem? Well, first of all, the Borrelia bacteria live in connective tissue, which you have all around your body. And what that means is that you kind of have lots of different symptoms. So because you have lots of different symptoms, it can be difficult to diagnose. And quite often, the symptoms of Lyme disease are, mistaken for other illnesses like chronic fatigue syndrome or MS, dementia, depression. And actually, you might have heard of it being called the great imitator. That's one of the other ways that it's described. Testing is unreliable. So the situation on testing is one of these circumstances where you have to have the right test at the right time. There's a window to get a positive test. You do it too early, you don't get a positive test. You do it too late, you don't get a positive test. But what that tends to mean is that people go to the doctor, they get a test, comes back negative, you haven't got Lyme disease. When in actual fact, it might just be you haven't had the test at the right time. At the right time. So testing on its own should not exclude Lyme disease. One of the other things that is also classic in Lyme disease is something called a bullseye rash, which I'm going to tell you a little bit more about in a second. Where that rash exists, it is in itself diagnostic. The problem is, it doesn't happen in every single case, and also in some cases it doesn't look classically bullseye rash, which then means it gets mistaken for other skin conditions, or is not recognised as a bullseye rash. There are treatment guidelines, so NICE in the UK does have treatment guidelines for acute Lyme disease, but if you don't get that acute treatment, then there isn't recognised treatment pathways. There aren't any specialist clinics in this country, and many GPs, many healthcare professionals are not really aware of Lyme disease. And one of the things that we did as a charity is we've developed a toolkit to help educate GPs, healthcare professionals, even the public, about Lyme disease. So that might be something you want to follow up on. The symptoms of Lyme disease vary. So, if you wanted me to give you a very simple list of things to watch out for or to tell people to watch out for, that's not quite so easy. So what I've tried to summarise on this table is the symptoms at different stages. So on your left, you've got the symptoms of what I'd call early Lyme disease. In the columns 3 and 4 on the right, the symptoms of later Lyme disease. And it's also worth noting that even people about 10 to 20% of people who get early treatment can still go on and develop longer-term symptoms. And also children themselves have maybe more slightly different symptoms, which is why I've flagged those on the right-hand side. So, and really the longer somebody goes untreated, the more difficult it is that they are, and less likely it is they are going to get recovery. So a little bit more about the rash. So it's officially called erythema migrans. You might hear people talk about an EM rash or a bullseye rash. Typically appears 3 to 30 days after tick bite, but sometimes it can be longer. Thank you. I've got a glass on that table there and I was thinking I should go and get it and then I can speak properly. Thank you. That's better. Typically it appears 3 to 30 days, sometimes longer. It's not itchy, it's not painful, and it can be easy to miss. It doesn't always appear at the site of tick bite. It can be a single rash, it can be multiple rash, it can be different shapes and colours, and I've got a few other slides coming up just to show you what some of those variations look like. Not everybody gets them. About at least 30% of people don't get the rash. And I know another important point is that the rash goes doesn't mean the infection's gone. So it's a really important indicator of Lyme disease, but just because the rash is cleared, the problem hasn't gone. So a few other pictures here. So here's a few examples of rashes that maybe are a bit fainter or a bit less defined. And also examples of rashes that can vary in size and number. So you can see on the left there, quite a big one. You can see on the other pictures, the middle picture, something that's a bit smaller. And then on the your far right-hand side, multiple rashes. So, it's a really important indicator. If it's that classic, it really is diagnostic. But, basically, I think if you develop a rash after a tick bite, it should probably raise a warning flag. The treatment of Lyme disease. So I think, as I mentioned previously, there is guidelines, nice guidelines on how to treat acute Lyme disease. If you've got that bullseye rash, you don't need any tests. You can go straight to having treatment. And it really is important to treat quickly and not wait. If treatment is required, then that's usually antibiotics that can be prescribed by typically a GP. But in today's world, we also see things like specialist nurses, pharmacists, other healthcare professionals who can also be aware of and prescribe for antibiotics for Lyme disease. And I think the big challenge here is that, if you don't get treatment at an early stage and you go on to, the infection in essence stays in the body, then you can go on to have some long-term problems and long-term symptoms. And what happens with those people is because their symptoms are so vague, they end up, the word I use is swirling around the health service, going from different specialty to specialty, who look at the little problem that they see, the symptom that they see, and the person really struggles to get a proper diagnosis. In terms of removing a tick, I know that, first aiders are old hands at this, but just a couple of things that I really wanted to emphasise, is sometimes it's useful to take a photo of the tick bite. If you go to see a doctor, your GP, and you're going to have to persuade them that this is a problem, then actually having a photograph can help. And then the other thing I'd really just emphasise is that, don't do anything to distress the tick, because if you distress the tick, then there's an increased risk of them passing on the infection. Things to watch out for after a tick bite. The bite is painless, as I mentioned before, so it's really a case of visually seeing it. Look out for that rash. Look out for flu-like symptoms, fatigue, headache, muscle and joint pain. If the rash develops, take a picture of it, draw a line around it, all that kind of stuff that you guys know about. And I think the real message here is that if someone becomes unwell after a tick bite, then they should see the GP. I've seen you standing up, Corey. Noted. Someone had asked us about vaccines. So actually, there used to be a vaccine a long time ago. Over 20 years ago, there was a vaccine, but actually it was withdrawn because there wasn't demand for it. If only they'd known it. There are a couple of potential new vaccines for Lyme disease in development. I think the Valneva and Pfizer one is the furthest on. They've just started phase 3 trials in humans. But even if that is successful, and assuming that it is successful, they don't anticipate even starting the regulatory process for that drug until about 2026. So vaccines are still a few years off. So I think our big message really is that prevention is better than cure here. All the preventative measures are really important. Keeping the skin covered, light coloured clothing, all these things that I'm sure you guys are familiar with. But it's also really important that people enjoy the outdoors. So one of the key strong messages for us as a charity is that, the benefits of the outdoors outweigh the risk of getting Lyme disease as long as you take the right preventative measures, and that is the most important thing of all. So if you want further information, there's our website, there's a website of the other Lyme disease charities that exist in the UK, and we're also on the stand today if you want to come and ask us some questions.